It's Monday morning. 35 prior authorizations are sitting in the queue. 5 urgent submissions are due before noon. A peer-to-peer review is scheduled for 11. Your coordinator called in sick, and your physician has a full schedule. This is the reality of operating a Medicare practice today. The American Medical Association surveyed 1,000 physicians and found the average doctor now faces 39 prior authorization requests per week, not per practice, per physician. Managing that volume consumes 13 hours of physician and staff time weekly. That is a full workday and a half every single week, going entirely to administrative friction instead of patient care. This data visualization maps out millions of Medicare Advantage denials. When fought, over 80% of appealed denials are overturned. But look at this sliver. Fewer than 12 out of 100 are ever appealed. That recoverable revenue simply vanishes. Practices are not losing revenue to clinical errors. They are walking away from medically necessary care because their manual workflows lack the sheer capacity to push back against the payer. At the start of 2026, the regulatory environment shifted, putting even more strain on manual workflows. The CMS Interoperability and Prior Authorization Rule took operational effect. This timeline shows the new legal requirement for standard authorization decisions. Payers must now respond within exactly 7 calendar days. For expedited requests, the window shrinks to just 72 hours. Faster payer decision windows mean faster denials. Without the buffer of informal delays that practices once used to gather missing documentation, incomplete requests are now rejected immediately. With the window for submitting clean documentation tightening, the traditional method of managing Medicare prior authorization entirely in-house is mathematically breaking down. High-performing groups are breaking this cycle. Instead of hiring more overwhelmed in-house staff, they are outsourcing the entire workflow to a specialized team. Companies like Staffingly represent a modern blueprint for this problem. They operate a hybrid engine that pairs clinical reasoning AI with AAPC credentialed human experts. This external team integrates seamlessly, working directly inside your existing EMR system via an encrypted connection. There are no clunky screen shares and no data re-entry. AWS Bedrock Clinical AI reads the patient chart, extracts relevant data, and drafts the narrative using specific Medicare policies. Then, an AAPC credentialed specialist reviews the draft, applies clinical nuance, and handles the final submission through the correct payer portal. By pairing AI processing power with human expertise, the standard turnaround from intake to submission drops to just 4 hours. A workflow that takes an in-house team almost a week is executed in half a day. Submitting initial authorizations quickly is critical, but we must also solve the 2 most expensive bottlenecks: peer-to-peer reviews and final appeals. Right now, physicians spend hours defending cases uncompensated because they are forced into calls with underqualified reviewers and rarely receive adequate preparation beforehand. Staffingly neutralizes this bottleneck. Exactly 30 minutes before the call, the treating physician receives a highly structured brief. It is armed with clear chart highlights and the precise Medicare policy citations needed to win the case. If a denial does happen, the system catches it instantly. Every single denied claim automatically routes to an appeals agent, equipped with a structured evidence pack to fight the decision. This level of systematic preparation and automated appeal tracking ensures that medically necessary care is approved and revenue is captured. Let's look at the financial reality of maintaining the legacy model versus adopting this new blueprint. This scale compares the hard costs. A fully loaded in-house Medicare authorization coordinator costs a practice up to $84,000 a year in salary, benefits, and training. Staffingly's dedicated service operates at a fraction of the cost, running just $399 per position per week. And while the practice slashes its overhead, it simultaneously recaptures that 80% of denied revenue that used to slip past the appeal window. Adopting this blueprint eliminates the administrative bottleneck and secures the revenue that manual workflows simply cannot reach. Transitioning to this model is designed to be frictionless. A practice can go live and begin routing volume in just 5 to 10 days. To eliminate the risk of adoption, Staffingly runs a 2-week risk-free pilot. You verify the throughput and accuracy in your own environment before making any long-term commitment. Data security is absolute. Operations begin with an immediately executed business associate agreement.
full HIPAA compliance, and strict adherence to SOC 2 Type 2 standards. Stop sacrificing your staff's time and writing off medically necessary care to administrative burnout. Book a demo with Staffingly and secure your revenue today.